Well, hi, everybody. Great to be with you today. My name is Greg Olsen. I'm the director of the New York State Office for Aging. I'm very excited to have this program today. I have with me Dr. Ann Sullivan, who's the commissioner of the New York State Office of Mental Health. And I will introduce Ann formally in a second. But our agencies, Dr. Sullivan, have done a lot of great work together, and that's really thanks to your leadership. You have an amazing staff. I think we've done a lot of good work together to help older adults and their families on this issue. You know, for folks that are, traditionally know the Aging Network, May is Older Americans Month, but many people may not know that May is also Mental Health Awareness Month. And we have many older adults across the state suffering from mental health issues such as depression, anxiety, and the results of isolation and loneliness, which we saw tremendously spike up during the last 14 months or so. And so today we kind of come full circle because it was a year ago, May, where Dr. Sullivan invited me to be on her Facebook Live. We had never done one before, to really talk about the impact of isolation and connectivity among older adults. And you have created the beast, Dr. Sullivan, because your inspiration launched us, and we do 2 Facebook Lives every month since. So I really want to thank you for that. You know, I don't traditionally read full bios, but I'm going to do that today because Dr. Sullivan is not only an amazing human being and a great leader for the office, and I think we might be 2 of the longest serving state agency heads in New York State. But your background in history really is impressive, and I want to make sure people understand that. So if you all bear with me for a second, I don't mean to embarrass you, Dr. Sullivan, but Dr. Sullivan is currently the commissioner of the New York State Office of Mental Health. As commissioner, she is responsible for a multifaceted mental health system that serves more than 800,000 individuals every year. The Office of Mental Health operates psychiatric centers across the state and oversees more than 4,500 community-based programs. As commissioner, she has guided the transformation of the state hospital system and its emphasis on recovery and expansion of community-based treatment, reinvesting over $100 million in community services, implemented the incorporation of critical recovery services for the seriously mentally ill and the Medicaid benefit plan, and expanded services for the mentally ill in the criminal justice system and community reentry. Working closely with all mental health providers and health plans, she's been guiding the integration of physical, mental health and substance abuse and care and treatment, the integration of early prevention, wellness, and social determinants of health and service delivery, and the statewide implementation of critical programs such as zero suicide, first episode psychosis teams, crisis intervention services, and school-based mental health clinics, which are all absolutely critical. Previously, she was the senior vice president for Queens Health Network of the New York City Health and Hospitals, responsible for Elmhurst and Queens Hospital Centers, 2 public hospitals that serve a community of more than 2 million people in New York City. She also served as Associate Director of Psychiatry and Medical Director of Ambulatory Care at the Gouverneur Diagnostic and Treatment Center in Manhattan. Dr. Sullivan grew up in Queens, New York, so a native New Yorker, graduated from NYU and its School of Medicine and completed her psychiatric residency at the NYU Bellevue Hospital in 1978. Dr. Sullivan is a distinguished fellow of the American Psychiatric Association and has served as the speaker of the American Psychiatric Association's Assembly. She's a clinical professor at Mount Sinai School of Medicine, a fellow at the New York Academy of Medicine, and a member of the American College of Psychiatrists. So welcome, and thank you so much for being here.
Oh, thank you so much, Christian. Thank you for reading that. I think what it speaks to is that just like many of the individuals you serve, I am an older New Yorker, and I have been working for a long time, and I've had really the pleasure to have experience working with you, which has just been terrific. And I just want to thank you for the partnership that we've had over these years in terms of working with our older New Yorkers and with individuals like me who need the help all the time of the Department of Aging. So thank you so much. Thank you.
No, and I appreciate it. And I think, what's different about today, we're going to focus a little bit on older adults, but, people live in families. A lot of times people talk about systems and how siloed they are. We do that with people too. We put children over here, we put middle-aged people here, we put older people here, but older people live in families like younger people do. We have older people caring for kids and grandkids. spouses, neighbors, friends. You have middle-aged individuals who are caring for children, maybe another relative and an older adult, and you have a lot of children who are now, caregivers, and that's an industry term we use. What's a caregiver? It's a person doing a task for somebody else to help them. But I'm going to throw a couple stats at you just to set the context, because there's no more important time to be having this dialogue than during this pandemic, because so many of these issues have affected so many people and risen to the top. But CDC released some information in the fall of last year that, again, when I say caregivers, I'm talking about people like you and me that are just helping to care for, a spouse or a child or a grandkid or a neighbor or a disabled child or somebody with severe and persistent mental illness, or any of those family dynamics that kind of keep us all connected. 61% of them last year were worried about caring for somebody. When you hear the term worry, that can manifest itself into stress and depression and other types of things. 31% contemplated suicide last year versus 3% of the general population. 33% used substances to cope versus 6% of the general population, and 50% used food to cope, which then has all kinds of other impacts on health and diabetes, how you feel about yourself, which can then lead to things like depression and anxiety. So I'm going to stop there and I'm going to throw it out to you to set the context. Tell us a little bit about what Mental Health Awareness Month is.
Well, let me just say that Mental Health Awareness Month, and I just found this out earlier today, has been around for a long time. It's been around since 1949, actually. And the goal is to make everybody aware that your mental health is just as important as your physical health. David Satcher, who was one of the great Surgeon Generals of the US, said there is no health without mental health. And that's so true, that we can't consider ourselves healthy unless we're thinking about our mental health. If anything has been taught to us by this pandemic, it's just how much the outside world and what's happening around us can impact our mental health. The stress, anxiety levels, you gave some statistics about caregivers, and caregivers are one of the most vulnerable groups. But across the board, everyone has been impacted emotionally by this pandemic, some more than others. But throughout, and whatever statistics you look at, there are 40 to 50% of all New Yorkers have a significant emotional impact from this pandemic. And when you look at youth, you mentioned families and kids. When you look at youth, there was a very sad study that was done in, it was between March and July of 2020. And 4,200 children lost a caregiver or a parent in New York State. That's incredible. When you think about the burden to those families, what that child is experiencing, what the caregivers who now have to move in to take care of those kids are experiencing, but that kind of impact is something that we have not experienced in decades in this state. And when we look at our underserved communities, when we look at our Black and Brown communities, those losses would double the losses in other communities. So the reality is we have severe impact on our communities. We have severe impact as individuals. Now, sometimes when people get that impact, they can be very resilient, and they can have moments where they're depressed and moments where they're anxious, but overall they can kind of come back. They can kind of use things that they've learned over their lives to cope. But sometimes it just gets too hard. Sometimes it's just too difficult, and individuals begin to get depressed, get really stuck in a way that can be for weeks or a month, where you're not interested in things anymore. You don't really want to get involved. You feel like irritable. You feel like can't be that you're not yourself anymore. Then it's time to think about getting some help. And I think that we should never be reluctant to do that. I always give the example, if you fell down and you hurt your arm and it was really hurting and starting to get bruised or something, you wouldn't hesitate to go to a doctor and say, hey, what is this okay? Do I need help, or is it broken? But we hesitate when it's an emotional issue, and we shouldn't do that. So if you're beginning to feel like it's too much, you're feeling it's overwhelmed, if you're feeling that you can't go, or you begin to see signs in other members of your family, then get help. And you can get help in many, many ways. You can certainly get help by going to your doctor. You can go to your pediatrician for your kids. You can go to your own doctor. You can talk to them about it. And then we at the state we have a really great emotional support helpline that you can call if you don't know who to call or who to talk to. You can sometimes talk to families or friends, but you shouldn't keep it inside. And if you begin to feel too overwhelmed, you should always get help. It's just so critical. So I think we've all been experiencing this, and some of us more so than others, caregivers, frontline workers, people who had the experience of dealing with the height of the pandemic, the healthcare workers, and people, and our kids, because they haven't been in school, they haven't been around their friends, and now it's starting to open up, but it's still not back to normal. And so there's been an impact on them, and there's an impact on kids, if there's an impact on other members of the family. So yes, we're all experiencing this in New York, and I think we have to come together. And we also have to know that sometimes you really have to ask for help.
Yeah, and I think that those are all great points. And when you talked and you cited, there is no health without mental health. So let's talk about that example. If I have, my heart hurts, or I have some other thing that I know physically is not wrong, you're absolutely right. I'm not going to hesitate to go to the doctor. Now, there may be barriers for some people if they don't have insurance or things, but just generally speaking, that there's a cause and effect between that. Let's talk a little bit about the stigma. And, I'll be the first one to admit, and I'm not ashamed of this, there's depression and anxiety in my immediate family and in the larger family. It's just, it is what it is. And there are many people like me out there, that would go to the doctor for the broken arm, but will suffer in silence and not recognize that they can significantly improve their lives or the lives of their families if it's not, me individual, if it's somebody else. So how do we, and I know we've come a long way, but we still have a long way to go. How do we overcome the stigma? And I think one of the tools that you guys put together really early on in the pandemic was the 800, the helpline, and the over 7,000 volunteers that came forward to take those calls. So maybe even starting with just an anonymous phone call to make that initial connection. I don't know if in your opinion that would be helpful, but talk to me a little bit about stigma, because that seems to be, or fear, the biggest barrier in getting the addressing mental health issues up to where we are with addressing physical health issues.
I think that we all have to recognize that the stigma about mental health has been there a long time. It's kind of a bit embedded in our culture. Somehow we all feel a little bit more guilty about having a mental health issue by not being able to be strong enough, let me say, or capable enough. That's the way it feels, because why should I need help? I should be able to handle this. And there's other people who have much more serious things going on than I do. Why should I need help? Or if it comes, sometimes people feel sometimes people don't even recognize it, but often there's a kind of a shame and a kind of discomfort of feeling you have this problem. And sometimes as a parent, you can feel a little bit worried. You're less likely to tell a friend that, your child is having an emotional problem than you might be, he fell yesterday and he broke his leg. That's easier to talk about. I once had a friend describe to me that suppose you've had a serious mental illness and you've been in the hospital and you come home versus someone who comes home from the hospital from a heart attack. And she said, my community, if you come home from a hospital with a heart attack, they bring you food and they give you a cake and they welcome you. And if you come home from a psych hospitalization, nobody wants to talk about it. And I think that's a key way to think about it, that we somehow have this embedded in the way we think and feel, and we have to get rid of it. We just have to get rid of it, because it's just let me just say it's old stuff and it doesn't really make sense. The mind and the body are intricately involved. And we all know that depression, just like any other illness, is something that you can really treat and deal with. And if you do that, then people can go forward and do the things that they want to do. So that anxiety about saying to someone that I've got a problem, got to get past. The helpline that you mentioned, we've had 80,000 calls on the helpline since March of last year. And I would say 2/3 of them are individuals who never, ever called for mental health before. And that is so great. That means that people are feeling more comfortable, as you say, about picking up that phone. It can be totally anonymous, but saying, I'm having some difficulties. We've gotten calls from parents who are worried about their kids, from kids, usually teenagers, sometimes worried about themselves and their issues, but also kids worried about their parents, who would call us and say, my mom doesn't seem to be doing so well. I don't know what to do. And we've gotten calls from all ages, all age groups, We've had from some of our older adults who wanted to talk to someone or had a daughter or a son who were going through things. We had calls from spouses who said, I can't talk about what I'm feeling because my husband's an EMT and, I don't want to worry him, but I'm really worried about this pandemic and I don't know what to do. And they would call and we would talk and that would help them get past it. And if whatever was going on was more severe, then we talk with them about possibly getting some help somewhere else, connecting to services. And so about, somewhere about that other third of the individuals sometimes needed more. And then we also have now a whole crisis counseling program. So you can get counseling for several sessions just focused on the experience of the pandemic, which is terrific. And you get that through the same support helpline. So basically we have things are there for reach, and I think you have to use now. There's simpler things too. If you're you can go to the New York, we call it Project Hope, New York Project Hope website, and it can give you just some tips about how to relax. During the day, when you're tired, what do? You might take a nap, if you can, or you might just rest for a minute. You give your body a chance to get better. Sometimes you have to give your emotions a chance. So the other thing we have available are some quick tips of, some relaxation exercises that you can do sitting in a chair. You don't have to get up, you don't have to go to the gym. Some breathing exercises that you can do, things that just help you get your emotions back in line. And those can be very, very helpful, especially during the pandemic as well. So there's that just to keep a mental wellness, but then if things get too tough, you should reach out. And I think the stigma is something we all have to face. We're doing a lot of what we call mental health first aid training, which helps people learn the signs of mental health and feel comfortable about asking somebody. So that's the other thing I want to emphasize. If you have a friend or a parent or a child who you're concerned about, please don't ever feel reluctant to say, how are you feeling? Are you having extra trouble because of the pandemic? Are you feeling anxious or depressed? You can never cause it by asking it.
That's right.
Some people have said to me, if you ask somebody, it'll stop them thinking that way. That's never the case. If you ask somebody, first of all, they're tremendously relieved to speak with you. And if they're not, then they'll just say, oh, no, I'm okay. But if they do they feel better being able to talk about it. So please don't ever hesitate, because you can be an agent that can also help people to destigmatize this and feel free and open to talk about what they might be experiencing.
Yeah, thanks, Dr. Sullivan. And I believe Kelly has put those resources in the chat box. And you're right about mental health first aid. We provided a lot of training to our network in mental health first aid. So again, helping regular people help other regular people is really important. So again, the last 14 months have clearly been a game changer for everybody. It's been very stressful for everyone, really, regardless of age. What are the additional challenges that you guys saw in dealing with older New Yorkers because of the virus?
Well, I think one of the things is something, we had talked about, as you said, a year ago, which I think was highlighted during this virus, which is the isolation that has happened to so many people. And there's been so much written and talked about that for all New Yorkers. But I think it also affects older people in a particular way that, to make sure that people still have been able to make those connections, and that isolation can have an impact. But there have also been, some very interesting studies which just came out recently about older adults in multiple countries, not just the US, but US, Canada, European countries. Most studies have been done in European, Spain, US, British, about there being somewhat more, a little bit more resilience sometimes also among older adults. So it's an interesting thing that this isolation is so important, but also there's a kind of wisdom. It was one of the terms, one of the articles used, which I thought was great. Wisdom among older adults that has helped them in some ways sometimes cope with something like the pandemic. So I think it's a mixed bag here that I think often older adults also have something to offer to others, that their experience of their lives, the things that they've been through, give them a bit of a measured sense. On the other hand, older adults, like everybody else, have experienced tremendous losses in this, whether it's friends that have lost, but you can't underestimate the loss of life here in this pandemic too. 50,000 New Yorkers, over 50,000 New Yorkers have died from this pandemic. And there's like 5 to 10 people impacted by each one of those losses. So it's a huge number of people who've lost someone very special to them. And I think for older adults, that's very, who sometimes are isolated or ready to lose someone can be very, very devastating. So I think that those things, there has been there's a significant impact on older adults, but there's also this other balancing act, which some of the studies have seen that sometimes older adults can be more resilient than we think too, in terms of dealing with this and being supports to others. And that's one of the things when you talk to people who are getting through this pandemic, a lot of it is, as you said, get away from that isolation and be supportive of each other. And that mutual kind of support and contact, even if it's been virtual like this, is tremendously important. So to keep that going and keep it going post-pandemic is very important. Because I just want to emphasize that sometimes people's reactions to a pandemic don't occur while it's happening. They can be delayed. So you can sometimes get through this and say, well, I got through it, and then suddenly find that you're not feeling so good, you're not so interested in things, you're feeling kind of depressed, or that you don't want to contact people. You call up, you used to call friends a couple of times a week, but now you don't really want to. You begin to get depressed after the initial stress of everything happening is gone. That's when depression or the anxiety hits. So we really do have to be vigilant over the next year to 2 years, really, and especially with our older adults, to see if the impact grows, and make sure that isolation doesn't stick around, because that will make it certainly could make it worse.
Yeah, and I think that one of the things I was worried about when we had our last chat a year ago in the same type of format is those folks that were isolated, and we're still concerned about that. And there's a variety of new things that we've been able to put in place using technology, but for a lot of people, technology is never going to be the solution. What my point on this was just really how proud I was for New Yorkers that picked up the phone and made wellness calls, and police officers that stopped in to do checks and really take care of their neighbors. And I like the word that you use on the resilience. I think people learn life skills sometimes when they're older, that they're able to cope a little bit better. So now you shift gears and you talk about children and the different part of the age spectrum. I have 2 kids in school. For me, I'm much more outdoorsy. So the impact of the virus outside of my work was much less than it would be on my kids, who didn't go to weren't in plays and couldn't do softball, all the extracurricular activities, but also one of them was young enough where just that interaction, being social creatures and learning from being around people, that was absent. And then you have the learning issues, the lack of access, again, all of that. So talk to me a little bit about your experience on really the impact of kids, because that's going to be both a short-term problem and a long-term problem for many.
Yeah, I think the impact is everything you said, and youth, it's developmental time. So the importance of, social connections, all those things that you mentioned, just the social activities, kids being out, kids being involved, learning together, learning the social skills that kids have to learn. All that is so important. And for many kids, that's been put on pause for a year. So I think what we're going to see when kids come back is some significant differences in maybe not quite as mature in some areas. There's also probably been some learning that's been lost depending upon the particular situation. But they can also see then, so you're going to see those, I think, generically. But then for some kids, depending upon, their makeup, just like adults and just like everybody else, they might be a little more anxious or depressed about everything that's happened. Depending upon the losses in their families, depending upon the emotional and financial strain in their families, kids are, they feel that, they notice that. So I think in those families, it's even more important that sometimes someone be there to help the family and the child cope with what's been going on during the pandemic. So I think we can expect to see some of the things, the way kids can react to something like this. And usually their reactions are a little different than adults. They're not likely to tell you, some younger kids are not likely to tell you that they're sad. They're more likely to maybe to stop doing things they used to do, make a change. I think the biggest thing for parents and caregivers to think about is there's a significant change, then something might be going on. So a kid who before was really social doesn't want to talk to his friends anymore, or do Zoom, or seems to be spending too much time in his room, and those kinds of different things Sometimes kids get more withdrawn. Sometimes they get more irritable. If they're young, sometimes they get more clingy. They get a little less independent when something like this happens. For adolescents, sometimes you can see more direct depression, but often you'll see it indirect too. Kids will just not be interested in things, or they'll just be they'll be more annoyed, more irritable. They'll show signs of sleeping a lot. Kids, adolescents sleep well already, but sleeping more than they ordinarily do. And sometimes you have to watch out for drugs or alcohol use too, because that can kind of happen sometimes when kids don't know how else to cope. But you look for those changes, and if you see them, you should talk to your kid about it. You should talk to your child. You should say, is something going on? Start there. But if it doesn't get better, then I would suggest to talk to your pediatrician, or you call one of ours, like one of our lines for help, to say, what should I do? But you shouldn't just assume it will always go away, especially if it lasts for a period of time. Now, adolescents can have ups and downs, but if it lasts for a while and you see a significant change and your son or daughter doesn't seem to be moving in the way they were, then you should pay attention to it, and you should get an idea. Maybe it'll pass, but maybe you should get some help to make sure that they're doing okay. It's going to be a transition, I think, going back to school. Don't assume that now the schools are open, everything's back, everything's fine. Like I said before, some kids, it'll be a delayed reaction to schools. We have seen more youth coming to emergency rooms with severe anxiety, depression, and sometimes even with suicidal thoughts or suicidal self-harm. So that's increased in the past couple of months. And we didn't see it as much during the height of the pandemic, I think, because everything was locked down, but we're beginning to see it now. So we know that this is happening, and people shouldn't feel stigmatized. They shouldn't feel that they're the only people it's happening to. They should get help if they need it, just like you would for anything else.
Yes, and I appreciate that. One of the things I was going to ask you, but you answered it before I had to do that, were some of the signs and symptoms. We have, well over 100,000 grandparents that are taking care of grandkids, and you have families taking care of kids. So you identified what to look for, some of the signs and symptoms, but as I was reading your bio, you have 4,500 community-based organizations, including every county has a mental health department. But if I were to see something, being a parent or a grandparent that I was worried about, that maybe, I allowed a little bit of time to go by, didn't see that it was getting better. You talked about pediatricians. In your opinion, based on your years of experience, what are the first top 3 recommendations on, if I'm hearing this for the first time and I'm concerned about my son or my daughter or my grandkid, where would I go first? Would that be my pediatrician? Would that be a county mental health department? Would it be a private mental health practitioner? Where would you recommend that traffic get directed, or is it through the state resources that you guys have built over the last year?
Yeah, so I think it's a little bit depends on the person, but there's a couple of options. I think the first one, some people, in my experience, people feel very comfortable sometimes talking to their primary care physician or their doctor. So that's one avenue, definitely. The other avenue is to think about the resources in your community. So you can, for example, every county in New York State has an ability to call and get an appointment at a clinic, every one. And you can also go through the Office of Mental Health website to get to a clinic. You can also call your insurer. Your insurer knows who's covered and how to get it. It's their responsibility to help you get services when you need them. So that's another outlet. And then some people, that just seems a little bit too convoluted. And so just calling, for example, the emotional health line and saying, I want to know where to go, they will do that for you. They will connect you right away, just like if you called your county, et cetera. So that number that appears in the chat box, which is the social emotional hotline, just call and say, I really would like to talk to someone. They will connect you with, you can explain your insurance, or if you have it, you don't, whatever, and they'll connect you to a provider that you can work with. So that's a direct way if you're feeling that. But you can also go to any of the local, also there's crisis helplines in every county too. We're going to be kind of pulling that together as a statewide number soon, but that exists in every county. So there's multiple ways to do it. If you really don't know where to begin, you feel like you're struggling, then just call that number. That's the simplest way. but there's the other ways. And then there are your pediatrician and any local providers. And your insurance company can help too if you want to. So I think that there's plenty of ways to do it. It depends a little bit, I think, on the individual, what they feel more comfortable doing.
Yeah, no, that's great, because I don't want people who are viewing this live or in the future to be like, well, I don't know where to go, so I'm just going to drop it. So you heard Dr. Sullivan. There are many, many, many points of contact, and probably the easiest one to start with is what the state has built through the Office of Mental Health and under Dr. Sullivan's leadership to really do this, make it as easy as possible to get people connected to try to help them. So I'm going to shift gears again, because what's drove me nuts living in New York for the last 14 months is the incredible response in trying to slow the spread and do the right thing in this state. That's not everywhere, and not everybody followed the guidelines. Not everybody got their news from, the most trusted sources, and people weren't wearing masks. And, a year into it, we're still talking about it being a hoax and it's like the flu. And then again, places across the country, sometimes you don't even know what people are thinking. This is far from the flu, clearly. And it has been a long-standing, really devastating time. But we're at the end, or almost at the end here, and you don't put your head down and start walking if you're running a marathon in the last mile. You suck it up and you run and you cross the finish line, and that's the vaccine. And so I think we're doing a great job, and Governor Cuomo has just, I think, been spectacular in every part of the response. And the vaccine numbers are great, particularly among my population, but there's always going to be those individuals out there that, not sure the information they're getting, not sure the science, not sure what to do. Is some of the disinformation that people are receiving about the vaccine, increasing things like anxiety, because you're not sure who to trust. And, we've been told not to trust government, but I can tell you, I work very closely with many, many agencies, and I do trust government. I'm part of government, and that's what we're here to do, is be public servants.
Yeah, no, look, I absolutely agree with you. And I think that, the misinformation, I think, is very serious. I think it frightens people. I think it makes them anxious. And I think that, we try to get out the message kind of clearly that, there've been I think in this country, there've been over 150 million people who've been vaccinated. So and safely vaccinated. I mean, that's huge. Just think about it for me. And compare that to 50,000 people who lost their lives just in New York State due to this virus. I think if you weigh the odds here of, in any way you want to calculate it, of what's a safer way to be, that vaccines come out on top. And, I've been vaccinated, my entire family now, pretty much everyone's been eligible. And as soon as my grandkids are really young, but as soon as they get the eligibility, I'll make sure my grandkids are vaccinated. It is safe. It doesn't do anything to your DNA or anything that could hurt you. It basically lets your immune system get a boost so that you can fight this virus if you come in contact with it. That's what it's all about. That's what every vaccine is about. And those of us who are older and remember the days of measles, measles is a very dangerous illness. I mean, I had friends who had very serious responses to illness. I knew kids in my neighborhood who had measles, who had problems hearing after measles. Some who were never or had. These were dangerous illnesses, and the vaccines have essentially made us have safe kids that grow up to be healthy adults. And this vaccine is the same. It's followed the same heavy-duty rules to make sure that it's safe. It's monitored. Almost every shot that's been given has been monitored in terms of any serious side effects. So what I'm trying to say here is, please don't listen to the misinformation. Listen to the CDC, listen to Dr. Fauci, listen to all the people who are telling you how safe it is. And I also think there's a piece of this that it's a responsibility we all have to our community too. It's not just, am I going to be safe? I might be healthy enough to get through this if I get the virus. But if I were to get it and give it to somebody else, that would be very sad. I wouldn't want to be in that position of having been someone who gave it to somebody else. So I think there's two pieces here. One is your health, the health of your family, and then it's a responsibility, I think, actually, to your community to be part of a team that says, we're all in this together and we all have to be safe. So yes, I agree with you. We're on the home stretch, but we're not there yet. I think we still lose like 30 or 40 people every day. I think yesterday to this virus in New York.
I know.
And think about that. Just think about the pain that causes. So please, everyone, try to listen to people, and really try to listen and understand, and then recognize that this is it's life-saving. I mean, it truly is life-saving.
Yeah, and I really want to double down on that. I also have been vaccinated. My family has. I didn't have any side effects from the doses that I had. I also want to let folks know that last night we published on the health department's COVID-19 website the county by county in-home vaccination points of contact. So many people may not know we actually have a statewide in-home vaccination program. And what you can do is go to that website, and we'll put it in when we load this up. We'll make sure that information is in there as well, so that if you can't get to one of the many sites that are available to just walk in and get your vaccine, and you need to request one in your home, we can give you the information to get you directly to that resource. But I couldn't agree with you more. I would feel terrible if I was carrying and gave it to somebody else. I mean, I think we've all talked about that in terms of the community that we have, that we do have personal responsibility to not only ourselves, but to our family. So let's think a little bit beyond the pandemic. And that's really hard to do because we've been in this, and virtually everything that we've been working on for quite some time has revolved around this for obvious reasons. But what are some future challenges, or maybe just the way services are delivered or organizationally that you're seeing in terms of building back better or changing the way things are for kind of a new reality, a post-pandemic reality, or just general things? Because I think one of the really positive things of a really bad situation is to have a conversation like this that has impacted so many people, where you can have a dialogue and you can connect people because they're not alone and everybody knows it.
Yeah, and I think one thing that I think has happened is that when we talk about awareness and awareness month, I think that this pandemic has also made so many more people aware and open to getting mental health services if they need it. I think that's one of the things which I hope will continue long past the pandemic. I think, you can see it in the news media, you can see it in the papers, you can hear it in presentations, that there's so much more discussion. Our governor talked about it a lot during the pandemic. There's so much more discussion about the importance of mental well-being. And I think that that's great. And I think that that is something that I think will continue past the pandemic. Just the other thing which we've gotten in terms of providing mental health services much more used to and realize the value of is this, which is telecommunication via something like virtual, like a Zoom, or basically telehealth. And during this pandemic, without telehealth, which enabled us to work with people by telemedia or by telephone, I don't know that we would have been as successful at helping all our individuals who are having mental health issues. So I think this new technology in terms of providing mental health care will continue post the pandemic, and I think will be very helpful. I think it will help us to reach people who have not been able to come to traditional, on-site services. But I also think it can expand what we do. We ran groups during the pandemic with telehealth. And I think that was really very impressive how well that worked. So there's lots of things you can do. Now, everybody doesn't have access to all this technology or isn't able to use it, and we'd have to work. There will always be other kinds of services, but I think we've learned a lot. And I think that's been one of the things. The other thing that I think we're really watching for and we're concerned about is that we are expecting that there will be a lot more people needing some services within the next year to 2 years. And I think there has been a lot of federal aid which has come through, and there's this large state commitment to mental health services. But I do think that we need to watch that and make sure that we have access, that everyone who needs services can get them. And we're working with with the state system, with state dollars, with the federal, with private insurers. I think that everyone has to come together here and recognize that we should have very easy access going forward We want to bring mentally healthy people out of this pandemic and into the next phase, and access to services is just so critical. And then the other is a kind of ongoing awareness of just mental wellness. You know, the schools, for example, even a little bit prior to the pandemic, but now are talking so much more about social emotional wellness and the importance of working with that from the earliest ages in the schools, right through high school and college. And I don't know that dialogue was there that much before. And now it is in a big way. And I think that that's terrific, because I think if we're going to get rid of that stigma, that question you asked for back, I think the biggest stigma buster will happen in our school systems. If our school systems make social, emotional wellness as important as PT, as physical health, and if you have the Mental Health Education Act, which was landmark in New York, the first state to say that all schools had to have mental health education, just think about it, that was like 4 years ago. 4 years ago. That's not a long time. It wasn't mandated until just 4 years ago. But when you have that, I think in the curriculum of the schools, all those things help to build people's awareness of emotional issues, their awareness of just emotional wellness, and of mental health issues, of depression, of anxiety. And I think that if that becomes as routine in your school days as talking about physical health or history or geography or whatever you learn, I think that will do a lot to help get rid of that stigma, so the next generation can feel very differently about going for help.
Yeah, I think that's great. Again, some of the positives that come out of a really bad situation, reimagining, building back better, and building some of these new things that should have been old things, but this is the opportunity to do that. So I'm going to introduce Kelly Matija from our communications team. I've mentioned her name a couple of times. I think we have a couple of questions for you, Dr. Sullivan.
Okay.
We sure do. Thank you, Greg. Our first question is from Cindy, and she is asking, are there any virtual caregiver support groups? I'm caring for my dad who has dementia and Parkinson's. How do I get connected?
Yes, there are some. What I would say is call that number, or the one I had, the social emotional helpline, and they will connect you to some of the caregivers. There are some, so they should be able to help you and get you connected. So just call them.
We can also help with that. We run a statewide caregiver program, and some of the things that you talked about and having to shift virtually, we had to shift much of our programming to virtual programming. We have a large caregiver program, so we can certainly provide you the resource as well. So thank you for that question. Do you have another one, Kelly?
I do. We have a comment from Rose about the vaccines, and she says, some of the problem is that we hear only one side of the truth. The news media and advertisers are manipulating people by emphasizing getting the experimental vaccine, but not conversation on both sides about how it really works in the body and side effects. So can you speak a little bit to how the science behind the vaccine and how safe that it is?
First of all, when they develop vaccines, I think, they develop them very carefully. That's one thing to keep in mind. They do tests on a number. First of all, they do all the basic science. And then they have good widespread studies of the efficacy of the vaccine and the side effects of the vaccine. And when they're doing those studies, they're very careful about the side effects. Now, if you look at the side effects, the vast majority of side effects are extremely minor. Most people will say they got a little pain in their arm where they got the injection site. Other people do have some flu-like symptoms after the injection. That's not unusual. That's not unusual with flu vaccines that you can get that. It's not causing the illness. That's what's important to know. What it is it's caused your immune system to react. And when you feel feverish during a flu, it's not caused by the bug. It's caused by your immune system's reaction to it, so that you get as a way to fight, what might be a virus coming one day. So it's not giving you the virus. That's the big thing we have to make clear. It's not. It's causing an immune reaction, and so you might have a little bit of a side effect to that immune reaction for some people, and that's small. And then they're the only, I know this has been all over the media, and this has been true. There's been a minute number of individuals, which they're not even sure is entirely the vaccine, who have had that blood clotting problem. I think it's like 15 out of 15 million in the United States. 15 million, 150, I'm sorry, 120 million, 15, 60, 15 to 20. Those side effects may be caused by the vaccine or may not. But they are recording them. I think that's the biggest safety factor. They are recording every possible. The vast majority of the 125 million people in the United States who received vaccines have had minor reactions. So the side effects, I think, are not anything to worry about. Any other long-term problems with vaccines, there just haven't been any. There haven't been any. And do you know what the percentage of people who have died of coronavirus who have the vaccine? Almost zero. Almost zero. Just think about that for a minute. 50,000 deaths in New York City for people who weren't vaccinated. 50,000 deaths. That's horrific.
It's phenomenal. It is. And I appreciate the question, because those, again, depending on what you're reading or where you're getting your news, that generates that type of question. I think, when we post this, we did a short PSA on the science behind this that we'd be happy to share. But I think one of the key things is that this class of virus was something that scientists have been working on a vaccine for 10 years prior to us ever knowing there was a COVID-19. So the emergency use authorization simply is that after the efficacy tests that Dr. Sullivan talked about, and that goes through multiple, NIH, CDC review, and then it went through a third step in New York State review as well to make sure that they were safe and effective before they went out the door. The emergency use is just that, it's emergency, but doesn't mean it's not safe. But since the vaccine really came out in January, they're continuing to add to the data, as Dr. Sullivan had talked about. So it's not like it was done when the vaccine was produced. They're constantly evaluating the data that comes in to make sure that it is safe and effective. And I think that the results at this point really speak to themselves. People are not going to the hospital who have the vaccine. People are not dying. That's really the key. So I appreciate the question.
And the only other thing I would say is, if you're really doubting, when you go to your doctor, let me just say, I'm assuming, I hope, you trust your doctor. And if he says, your blood pressure is high, I think you should have this medicine. Or if he says, I think I want to do a cardiac test because you're having some chest pain, I want to see if you have a heart attack, that kind of thing. You trust that doctor, what he's prescribing for you, what he's saying makes sense, because the person has worked with lots of other people and been trained to do it. Ask your doctor about the vaccine. Ask them, would they recommend that you get the vaccine? Because they're not telling you to get the vaccine. If they tell you to get the vaccine, they're saying that with the same way they're saying, take your blood pressure medicine, take your medicine for diabetes, do this for your health. They're doing it with the same medical knowledge and the same interest in your health. So I'm just saying, if you trust them for other things, you might think about trusting them about the vaccine. So ask them, what do you think, doc? How safe is it? And, do you have it? And what do you think? And is it? Because I think if you trust them for the rest of your health care, pretty much, I think you might think about trusting them for the vaccine too.
Oh, great. Well, thank you. And Dr. Sullivan, it was really great to have you back 1 year after you had me. I think, again, the partnership that we have, with our agency is amazing, but the work that you and your team does with your community partners across the state is really incredible. So I want to thank you for your time today. I want to let everybody know that in order to make these kinds of things happen, those are things that I cannot do. I'm not a tech person. So I want to thank Kelly Matija for my communications team. The resources are going to be in the chat box. Please use them. And some simple advice that Dr. Sullivan provided. Keep an eye on yourself, keep an eye on your loved ones and your neighbors. If you see something, have a conversation about it, make a recommendation. And it's okay to ask for help, and it's okay to seek assistance. It can significantly positively impact your life, the life of your family, and the life of your friends. So again, I can't thank you enough for joining us today. Mental Health Awareness Month should be every month, not 1 month a year, but we'll do what we can to continue to get the messaging out from that you guys put out, as well as the messaging from our agency, to make sure people continue to stay connected and to stay healthy. Join us in about a week. We're going to be celebrating Older Americans Month, which is also in May. And I look forward to joining you then. So thank you, everybody. And I hope you have a great day.
Thank you. It's been a pleasure. Thank you.